Well, I'll tell you something about chronic pancreatitis. This is again a disease of the pancreas, which is a small gland the size of a palm situated behind the stomach. It's a very soft organ, and this also has a disease condition called chronic pancreatitis, where patients quite often be complaining of abdominal pain radiating to the back for many years, but often doctors treat these patients as some sort of a gastritis, but in due course of the time, pain increases and patient has to bend down to get relief from pain, and that's when they start taking more and more painkillers. When investigated in the form of a ultrasound scan or a CT scan, one can make out that these patients have developed what is called chronic pancreatitis, where because of the repeated inflammation of the pancreas, they develop some sort of a shrunken pancreatic gland, and also it will develop stones in the pancreas, either in the duct of the pancreas or the gland of the pancreas. It's called chronic pancreatitis, and these patients in due course of time can also develop diabetes, because pancreas is the organ which produces insulin, which will control blood sugars, and when the pain becomes unbearable, where normal pancreatic enzyme medications and painkillers are not working anymore, a situation will arise when surgery may be required, and before surgery these patients we have to do tests like MRCP or ERCP to see how the pancreatic duct looks like and how many stones are there and where they are located, and when required, the patient has to undergo an operation either by laparoscopy or open surgery, by which we will go into the abdomen, locate the pancreas and open the pancreatic duct. That is the main channel which pushes the juice from the pancreatic gland into the intestine. That we will open the duct, clear the ducts, and will relieve the obstruction. In other words, the pancreatic juice is not able to flow into the stomach or the intestine, that's where the pain comes. So once we bypass it into a segment of intestine, the pain goes away, and the disease may not progress further. And then majority of the patients of this operation, they will be free of pain. Another important thing about this chronic pancreatitis is that some patients, a handful of patients, this pancreas can turn into cancer. Chronic pancreatitis is a pre-malignant condition. So it is important that if anybody is having undiagnosed pain, abdomen going to the back, one should see a doctor and make sure that there is no chronic pancreatitis. And if there is diagnosis of chronic pancreatitis, once again a good number of these patients will be all right with enzyme tablets and painkillers, but some of them will require surgery, which can be curative. Of course, alcohol is one of the commonest causes again for chronic pancreatitis, and patients who have any abdominal complaints after alcohol, in other words who are sensitive to alcohol, should avoid alcohol altogether or drink less. Thank you.